Today we're talking about cardiac arrest, when the heart suddenly stops beating effectively. Think of the heart as a pump. Its job is to send oxygen-rich blood to the brain and the rest of the body. During a cardiac arrest, this system fails. The heart quivers or stops completely, blood flow ceases. This is not the same as a heart attack, where a blocked artery stops blood flow to a part of the heart muscle, but the heart usually keeps beating. Cardiac arrest is an electrical problem, and it is immediately life-threatening. Without blood flow, the brain can be damaged in just a few minutes. Understanding why speed is so important is the first step to saving a life. Every second that passes without blood circulating means more potential damage to vital organs, especially the brain. The chance of survival decreases by about 10% for every minute that goes by without intervention. It's a race against time, and your actions can make all the difference. Quick, decisive action can bridge the gap until professional help arrives. The person's life is literally in the hands of those who are there when it happens. This is why public knowledge of these steps is so vital for every community around the world. So, how do you know if someone is in cardiac arrest? It's important to recognize the signs quickly and clearly. The person will suddenly become unresponsive. They will not answer you if you talk to them or shake their shoulder. They stop breathing normally. They might not be breathing at all, or they might be taking strange, gasping breaths. These are called agonal breaths, and they are not effective breathing. They are a sign that the brain is not getting enough oxygen. Check for a pulse. On an adult, you can check the carotid artery on the side of the neck. If you cannot feel a pulse within 10 seconds, you must assume it is cardiac arrest. If you find someone who is unresponsive and not breathing normally, you must act immediately. Your priority is to get the heart pumping again and get oxygen to the brain. Hesitation can be the difference between life and death. The simple steps of calling for help and starting chest compressions can double or even triple a person's chance of survival. This is a profound responsibility, but it is one that anyone can be prepared to handle with the right knowledge and a clear head. Remember, recognizing the problem is the very first link in the chain of survival. Once you have recognized cardiac arrest, the next steps are clear and must be done in order. If someone else is with you, point to them directly and tell them to call 911 and find an automated external defibrillator or AED. Being specific with your instructions ensures that there is no confusion in a high-stress situation. While help is on the way, you must start CPR. This is the most critical intervention you can provide. CPR involves pushing hard and fast on the center of the chest to manually pump blood to the brain and other organs. It is also very important to allow the chest to fully recoil or rise back up between each compression. This allows the heart to refill with blood before you pump it out again. This combination of depth, rate, and full recoil is what we call high-quality CPR. Performing CPR is physically demanding. This is why teamwork is so important. If another person is available, you should switch roles every 2 minutes. By switching rescuers, you ensure that the person consistently receives high-quality, effective chest compressions throughout the resuscitation effort. Continuous high-quality CPR is the bridge that keeps the person alive until a defibrillator can be used. Chest compressions are vital, but for many types of cardiac arrest, they are not enough to restart the heart. The most common cause of sudden cardiac arrest is an electrical problem called ventricular fibrillation. This is when the heart's electrical signals become chaotic, causing the heart muscle to quiver uselessly instead of pumping. The only effective treatment for this is an electrical shock delivered by a defibrillator. This is why using an AED as soon as possible is a top priority. Modern AEDs are designed for anyone to use, even without prior training. They provide clear, step-by-step voice instructions. When the AED arrives, the first step is to turn it on. The machine will immediately start guiding you. After a shock is delivered, the heart may or may not return to a normal rhythm. Regardless of the outcome, you must immediately resume high-quality chest compressions. The AED will reanalyze the heart rhythm every 2 minutes and advise if another shock is needed. This cycle of CPR, analysis, and shock continues. While basic life support focuses on compressions and defibrillation, advanced life support introduces more complex interventions. One of these is advanced airway management. Initially, rescue breaths can be given using a simple bag mask device. However, a more advanced airway is often needed. This involves placing an endotracheal tube that goes directly into the windpipe, or a supraglottic airway that sits above it. This provides a more reliable way to deliver oxygen and protects the airway from stomach contents. Once an advanced airway is in place, compressions can be continuous without pausing for breaths. Medications also play a critical role in advanced resuscitation. The primary drug used in cardiac arrest is epinephrine. Epinephrine helps to constrict blood vessels, which increases blood pressure and improves blood flow to the heart and brain during CPR. It is typically given through an intravenous line or an intraosseous line. The standard dose is 1 milligram, given every 3 to 5 minutes for as long as the cardiac arrest continues. For certain heart rhythms like ventricular fibrillation that persists after shocks, other antiarrhythmic drugs such as amiodarone or lidocaine may also be administered. While the team is working to resuscitate the patient, they are also thinking like detectives. They are actively searching for and treating any reversible causes of the cardiac arrest known as the H's and T's. The H's include hypovolemia, hypoxia, hydrogen, hypo or hyperkalemia, and hypothermia. The T's include tension, pneumothorax, tamponade, toxins, and thrombosis. Treating these underlying issues can be the key to achieving a return of spontaneous circulation. If the team's efforts are successful, the patient will achieve what we call ROSC. This means the heart starts beating on its own again, and a pulse can be felt. Unfortunately, not all resuscitation attempts are successful. There are times when, despite everyone's best efforts, the heart cannot be restarted. The decision to stop resuscitation is one of the most difficult in medicine. It is made by the team leader and based on many factors. This decision is always made with great care and consideration. The message is that high-quality CPR saves lives. From the first compression to the complex care in the ICU, it is the dedication to each step of the process that gives a person the best possible chance to not only survive, but to return to a full and meaningful life.